Hi everybody, my name is Kara Carnes and I'm here to present to you my capstone project presentation. I was able to choose a subject on mental illnesses and I chose to do anxiety disorders. So let's get started. Alright, so what is an anxiety disorder? Anxiety disorders are a group of mental illnesses which involve excessive fear or anxiety. Anxiety disorders are the most common of mental disorders and affect nearly 30% of adults at some point in their lives. We all experience anxiety, but with a disorder, it's actually way more extreme and more severe and more frequent. The distress and anxiety disorders keep an individual from living a normal and healthy life because they are scared and anxious to do the normal things that everyone does on a daily basis. Where does anxiety come from? Anxiety disorders is a combination of genetic and environmental factors. Risk factors include a history of child abuse, family history of mental disorders, and poverty. Anxiety disorders often occur with other mental disorders, particularly major depressive disorders, personality disorders, and substance use disorders. So anxiety can come from things that we've been through and experienced. Anxiety can also come from genetics, and it can also be a side effect of other mental illnesses. Statistics on anxiety. So basically, anxiety disorder was not even recognized until 1990 by the American Psychiatric Association. And what they have found is that it's the most common mental illness in the U.S. And about 40 million adults in the United States age 18 and older have this disorder. How does anxiety coexist with other disorders and what disorders coexist with it? With anxiety, depression is one of the most common mental disorders that coexist with it. Nobody really knows the exact reason why, but studies have found that 85% of those with major depression were also diagnosed with generalized anxiety disorder, and 35% had symptoms of panic disorder. When you're depressed, you have negative thoughts, and negative thoughts result into fear, and fear is part of anxiety. It is also believed to be caused in part by a malfunction of the brain chemistry. Generalized anxiety is not the normal apprehension of one feels before taking a test or awaiting the outcome of a biopsy. It's actually way more severe and extreme. There are a bunch of different anxiety disorders, but the main types of anxiety disorders is what I'm about to talk to you about next. One of those disorders being generalized anxiety disorder, which is also known as GAD. This is a disorder that displays extreme anxiety and worry for months and faces several anxiety-related symptoms. It is diagnosed to someone when they spend at least 6 months worried excessively about a number of everyday problems. This was discovered in 1980 when it appeared in the third edition of the Diagnostic and Statistical Manual of Mental Disorders. This is one of the most common anxiety disorders, and it's way more extreme than just a one-time anxiety attack. GAD symptoms. So the symptoms of generalized anxiety disorder include restlessness and feeling on edge, being easily fatigued, difficulty focusing and concentrating, tension in muscles, difficulty controlling the worry, difficulty falling and staying asleep. Another major anxiety disorder, and that's very common and known, is panic disorder. Panic disorder is when people who experience impulsive random panic attacks and are preoccupied with the fear of a repeating attack and can occur to those who have experienced a live traumatic event in their lives. So although people with panic disorder experience panic attacks, it's different from just experiencing a panic attack. So basically someone that is somewhere where they had a previous panic attack, it makes them think of that previous panic attack, and then they start to panic because they think they're going to have another one, which actually does cause another panic attack. It's usually diagnosed to those in their adult years, so about 2 to 3% of Americans experience panic disorder in a given year, and is twice as common in women than men. Symptoms of a panic attack are fear of loss of control, rapid heart rate, shortness of breath, dizziness and feeling lightheaded, sweaty palms of feet, chills, hot flashes, chest and abdominal pain, and those that have panic disorder actually panic a lot about death. Post-traumatic stress disorder is also known as PTSD, and this is when a person has been exposed to an extreme stress or a traumatic event in their life in which they responded with fear and helplessness, and they actually re-experience the event and they don't even know it, and they also avoid the reminders of the event and hyperarousal for at least 1 month. Obsessive compulsive disorder is also known as OCD. It is a disorder that is severe, and it's a disabling clinical condition that usually arises in late adolescence or early adulthood. If left untreated, it is very chronic. The obsessions are persistent thoughts and impulses, and then compulsiveness is a repetitive behavior. So someone that washes their hands 20 times a day, their obsession is washing their hands, and the compulsive part of it is the repetitiveness of them washing their hands. OCD affects 2.2 million adults. OCD is equally common among men and women. 1/3 of affected adults first experience symptoms in childhood. Social anxiety disorder is also known as social phobia, and this is a disorder where someone avoids going around other people at all costs. They are highly terrified that they are being judged in a negative way by others. They think that they are going to be rejected and not accepted by someone based off of what they say or do or how they look. It has an early age of onset by 11 years old, and that's 50%. And then a lot of people get it at 20 years old, and that's about 80% of people. This disorder affects approximately 15 million American adults and is the second most common diagnosed anxiety disorder following specific phobia. They're mostly worried about how other people are going to think of them, and they're worried about being judged. They become subconscious over things and believe that others are automatically judging them, makes them want to avoid any type of situation with others around. Usually the inception of this disorder is during the teenage years. Symptoms of social anxiety is feeling highly anxious, being around people, having a hard time talking to them, self-conscious, being anxious and embarrassed of being embarrassed or rejected, scared of offending others, being scared of being judged, worrying about an event that is weeks before it's even happening, blushing, stuttering, and shaking around others, having a hard time making friends, having a hard time keeping friends, and feeling nauseous. Other disorders that are not as long-term are acute stress disorder, adjustment disorder with anxious features, substance-induced anxiety disorders. Acute stress disorder is when a person experiences stress and anxiety shortly after a traumatic and stressful event that happened in their life, but it does not last long. Adjustment disorder with anxious features is when a life change occurs and they have anxiety right after that life change, but it does not last more than 6 months. And another is substance-induced anxiety disorder. This is a disorder where someone is used to having substances in their body, and then for whatever reason, it's discontinued, and their body is trying to understand and get used to this change, and this is where they experience anxiety. Medication and treatment. Medication for anxiety disorders can be antidepressants, it can be anti-anxiety drugs, and it can be beta blockers. Also, there is treatment that's not medication and that's not prescribed to you by a doctor, but more along the lines of therapy. For example, cognitive behavioral therapy and exposure therapy are two main treatment plans for those with anxiety that does not include medications. However, those that get medications and treatment therapy plans, they actually have better outcomes with their anxiety disorders. Alright, and here are the references that I used to get my information, which was very helpful. Hope you guys enjoyed this presentation. Thank you so much.